super important to us, as I know it is to you, that you get the very, very best results from your care. So what I'm talking about today is how to get the best results from your care, how to not further damage your spine during the corrective process, and how to make sure that when we look at that second set of films that we're going to get to see how much correction you got, you get amazing results, not just feeling better, which is really, really important, but also functioning better, and that your x-rays show great correction when we view them. Okay, so this is really, really important stuff. So watch this all the way through. So first of all, the first adjustment, especially if it's your first adjustment ever, but often if it's your first adjustment by us, people get some soreness or some discomfort. That is very normal. So can be stiffness, soreness in the area, can feel like muscle soreness. People even get headaches very, very frequently. So we are moving joints. The way we analyze your spine very, very specifically to every vertebra to the fraction of a degree and a fraction of a millimeter, we're gonna get exactly where that problem is, and we're gonna get that joint moving. In some cases, it hasn't been moving for 15, 20, even many more years than that. We have to make sure that it's gonna get moving the way it's supposed to. You're not here to waste your time and money by not getting results. So we're gonna do the adjustments that are gonna give you the best results the fastest. So what happens often, that joint gets moving, hasn't moved for a while, it's stiff and sore. It's like if you were to duct tape your elbow and leave it that way for 15 years and then suddenly take off the duct tape and move it, it might be a little bit painful process. I don't know, those of you who had the great joy of wearing braces on your teeth, you may have noticed that when they tightened up the braces, they got sore. This is very, very similar. And the same thing comes with your blocks, which we'll talk about in a moment. But headaches are normal too. Not very often, I'd say maybe 1 in 20 times people get a headache, but it is common because headaches are caused by lack of or changes in blood flow to the brain. So when we get an adjustment, there's a flood of blood up into the brain. And so when there's more blood, and in some of your cases, less air in the head and more blood, just kidding, but when there's lack of blood flow to the brain and then all of a sudden a rush of blood, it can cause a pounding headache. That's normal. So it's very, very important to get that chiropractic is different from medicine. Medicine has some wonderful benefits, but the purpose of most of medicine is to shut the body's functions down so you don't feel symptoms. Our job is to wake the body up, and in that process, you may feel some discomfort, some pain. So here's what to do and what not to do. Number one, don't pop it or twist it. If you have to take a medication where the last thing we want to do is shut the body down, but if you're too sore, some Advil or ibuprofen isn't the end of the world, but it does shut down the function of your nervous system, and if you can avoid that, I would. Drink some water. It's amazing what water can do to relieve stress and tension in the spine or in the joints, and stay hydrated anyway because it helps all parts of the body. Okay, so should you ice it? I get that question a lot. I don't love ice because ice creates more inflammation after you stop using it, but if it's really sore, you can ice for 20 minutes on, 40 minutes off for as long as you want. Okay, so if you have questions about your soreness, but if you have questions about anything, feel free to ask us anytime. I've been doing this over 25 years, taking care of patients when you include in the clinic. I've never heard a dumb question. And that's not just false niceness or some weird thing. You have questions about your body? This is your body. We love questions, whether it's about your adjustments, whether it's about your rehab and your blocks. So I'm going to talk about some common questions that we have with blocks. Your blocks we call your denturals. Most of you have denturals. They're very, very different for each person. And in fact, I hear this a lot. Oh, my cousin came over and I let him use my dentural. Please don't ever do that, because it's really common that what's good for one person is the exact opposite of what another person needs. So do not, it's like prescribing, it's like you take a prescription medication and you let your brother take it or something like that. That is not a healthy idea. It's very, very dangerous. So do not let other people use them. But how often do we use our blocks? As you may know, we've probably already explained to you, twice a day, every day for 20 minutes. Now, less than 1% of the people that we take care of can do 20 minutes right away on the block. So please do not just lie on them 20 minutes right away. I have a good friend of mine, a chiropractor, who's an amazing chiropractor. He took care of a Navy SEAL instructor, And he told the guy to go home, do these neck exercises. He told him to do 10 reps and then build slowly. The guy went home that night, did 1,000 reps of the neck exercises. Came in the next day, he couldn't move. Please don't be that person. I love enthusiasm. Do it right like we've told you. When it comes to your neck exercises strengthening, or when it comes to your blocks, build a little bit slowly. Our nervous systems are sensitive to big change, but the key is to build steadily. So let's say it's pretty common for someone to be able to do 3 minutes on their blocks in the very beginning. It's really common that those are painful. It's like your brace is tightening, like we talked about a minute ago. It takes some time to be able to build up to that corrective load. Now that said, you need to be at least 10 minutes on those blocks before they'll actually permanently change your spine. The curve is amazing. We've actually mapped these curves of the way human ligaments and muscles change in shape. For the first 10 minutes, it's called what we call elastic deformation, meaning it stretches quickly, it moves quickly, but then if you get off them, it goes right back down. But between the 10 and 20 minute mark, it's slower change to the angles and to the positions, but it's more plastic deformation, which means that it's gonna hold for longer and longer. So between 0 and 10 minutes, it's beneficial really only that you're getting toward that 20-minute mark. Most people build around a minute a day. If you're super athletic or used to moving your spine a lot, you may move a little bit more quickly. If you've been in a lot of pain or have inflammatory conditions like fibromyalgia or anything like that, build slowly, but please build. Some people may only improve 10 seconds a day. Maybe they can only do 30 seconds in the beginning. Just make sure you're moving in the right direction. It's much, much better for you to go on the blocks 1 minute the first day and you're not too sore, so the next day you do 2 and you try that out. Maybe you got sore at 2 minutes. Well, back off a little bit, maybe a minute 30, and then build just steadily. It's much better that you not get too sore so you don't skip 3 days or something, or skip a day. You're much better off just chipping away at it and building very, very steadily. Just what I suggest is brush that limit every day. Don't crush right through it so you're super sore, but just brush that limit up every day and your time will increase. It is very normal, especially if you have a block in the mid back or the low back, even in the neck. It's super normal to feel like it's gonna feel wrong for a lot of you. Just like if you put your hands like this, there's a normal way for you to put your thumb, and the other way feels super weird. Doing those blocks can feel super weird, and more than this, it can be painful. Just gently push through it. Again, if you have questions, please ask us, because we're here to help you, we're here to support you. By the same token, if you're not sure if your blocks are in the right place, if they're close, it's still pretty good, but you want to be as close as possible. Ask us. I don't care if you ask us every single time you're in. What that means to me is you're doing your work, and you're doing the work enough to have the questions. So if you have them, that's great, that's awesome, okay? So the other thing is, make your schedule here in the office. Make your traction schedule, make your adjustment schedule. Those are super important. If I get, oh doc, I was feeling great, and then it hurt again, but you missed a whole week of appointments, that might be why, okay? And so the other question that I get is, if I'm doing traction in the office, should I do my blocks on the same day? Yes, though they interrelate and they support one another, they're different. And the benefit of I'm gonna make a video on this totally separate, but the benefit of doing the blocks at home is you can do it twice a day, every day. Stops you from having to be in this office 4 hours a day, which we know you love us, but you don't wanna be here 4 hours every single day. So the blocks support it, but the blocks aren't as powerful as the tractions we can do in the office. So your traction is usually 3 or maybe 4 times a week. If you're here from out of town or out of the country and you're staying locally in a hotel, we may have you here for 4 hours a day so we can do your traction for that long. But they're very separate. Even on the days you do your traction, you do your blocks. Now it may be that you're sore and you want to cut back on your time on your blocks during that day that you did traction. Have some body wisdom, tune into what it's saying, but still just get on there for at least a few minutes. One thing that I forgot to mention till just now is there's this really cool invention. Amazon has them. I don't remember the name of it. On Amazon has them. They're these glasses that you put on, and it's like a periscope. So I'm looking straight forward, but I'm reading like this clipboard. I'm looking forward, but I'm reading the clipboard. This helps you watch your favorite shows or read your favorite book while you're on the blocks. So I type in Periscope glasses. It's these mirror glasses. They're like 15 bucks, not super expensive. A great way to go to be able to do what you want to do while you're doing it. So make sure I'm talking about this. So your posture regularly while you're going through your day. You should be sitting straight up. Everyone pretty much knows this. What I see a lot is not just kids, but a lot of us getting this text neck thing by tucking our chins down like this. This will not mess up your life much to make this one change. Instead of going like this, bend forward at the hip and hold your clipboard or your book or your phone or whatever your device. Hold it like this. If you look at this, I'm bent at the hips instead of bent at the spine. This is really, really rough to bend like this on your spine. Lean forward just like this. So that's a really, really important way to preserve the correction that we're doing. And then when you're in your bed every night, we sleep about 1/3 of our life, 8 hours a night. So that means by the time we're 45 years old, we will have been asleep for 15 years. That's pretty amazing, isn't that? So how we sleep is going to make a big difference. I've made a lot of videos on this, but your bed in general should be not super firm. People think the firmest bed is the best, but with the way our modern posture and culture is, our bodies do pretty well with a semi-soft mattress. Your head should not be stuck jammed way forward, but should be near flush with the bed. A Denroll pillow is an excellent pillow. You can ask us about that. And it keeps your head back and influences the curve in your neck positively that we want. So the best position to sleep is going to be every time on your back. Unless, of course, you're pregnant, especially late term, you should be sleeping on your left side. If you're going to be on your side, we don't want to be all twisted and kinked up. We want our ankles, knees, hips, shoulders mirrored. We don't want to be all twisted around, and we want our head level. We want a pillow that's going to support our head to be level, not kinked down or kinked up, just like that. Lastly, very importantly, chiropractic's purpose is to wake up and bring healing and life through your nervous system. A lot of people think that we're working on joints and we're popping joints till the joints feel better. What we're really, really working on is brain-body connection. We're working on getting the nervous system in a state of healing through correcting the structure of the spine. When the structure is normal, the body is always in a state of healing much better than when the structure is abnormal. So that is the purpose of what we do. You can really, really enhance your correction to your spine, improve your body's ability to correct, but also bring healing and peace to your nervous system and therefore to your whole body by programming in time for rest and relaxation. Sleep, of course, but time for meditation, and if you're inclined to prayer, time for prayer, time where you're tuned out and relaxing. There are millions of different kinds of meditation. We're all coming from different places as far as meditation. Some people are scared of it, like they're praying to the wrong God or something like that. But to me, meditation could just be a time of just peace and relaxation with no input into that nervous system. Doing box breathing. I have a video on box breathing. You can do that. You can read a scripture. You can read a Bible verse and just sit and just ponder that. But time where we're not constantly looking at our Instagram and our Facebook and our LinkedIn and whatever, where our nervous system is not made to have such powerful input into it all the time, especially if we're on blocks and we're doing traction and these things. Give your body time to rest and recover during that sleep, but also during the wakeful time. But when we're in meditation, our nervous systems can regenerate and restore and accommodate much, much more correction, okay? So I hope this has been helpful on how to get the most correction as quickly as possible and how to get the greatest results. As always, as I said before, please ask questions if you have them. I've never heard a bad question. So till next time, we'll see you soon.